I come to the floor today to raise awareness about the open enrollment period for health insurance marketplace coverage. Between now and December 15th, Granite Staters and Americans across the country can enroll in health care plans for 2020 through the Affordable Care Act's health insurance marketplaces. Tens of thousands of Granite Staters and millions of Americans will be eligible for federal premium tax credits to help pay the cost of monthly premiums, as well as financial assistance to reduce the cost of annual deductibles. But I'm sad to say that the Trump administration refuses to be a reliable partner in helping to spread the word about open enrollment. For the third year in a row, we have an administration that is focused on sabotaging the Affordable Care Act instead of raising awareness for open enrollment. This administration is even focusing resources on promoting enrollment in junk health plans that don't provide coverage for pre-existing conditions and that don't meet the Affordable Care Act's comprehensive coverage requirements. Now, after failing to repeal the Affordable Care Act in the Senate, the Trump administration is making an end run around Congress, trying to dismantle the ACA through regulation, administrative action, and lawsuits in the federal court. And as we can see in this chart, 2 years ago, the administration cut funding for advertising and outreach efforts to promote open enrollment by 90%. So the administration went from $100 million, we can see on that bar, down to $10 million in 2017, $10 million in 2018, and $10 million in 2019. These advertising cuts are really penny-wise and pound-foolish. They are part of the administration's concerted attempt to keep Americans in the dark about what their insurance options are. Federal advertising on television and through digital platforms and other media is critical to drawing a healthy and balanced mix of consumers into the marketplace. And in fact, research shows that California's state-level investments in marketing and advertising for open enrollment generated a 3-to-1 return on investment through lower premiums from a more balanced risk pool. So by refusing to adequately promote open enrollment, the administration is forcing our insurance markets to miss out on an opportunity to improve the markets, to lower premiums for consumers, and to ensure a healthy health insurance market, no pun intended, throughout this country. So that's why I introduced the More Health Education Act, to restore those health insurance marketplace advertising dollars and to increase outreach funding back to the $100 million a year. My bill would also prohibit the administration from using any of these funds to promote short-term plans or junk plans, plans that don't comply with the Affordable Care Act's requirements for pre-existing condition protections, among many other provisions that provide real insurance coverage for people who need it. The Congressional Budget Office projects that approximately 500,000 more people would enroll in the health insurance marketplace or Medicaid coverage each year as the result of my legislation. That's 500,000 people who would be insured and be able to better take care of themselves and their families, and they would have access to primary care, to preventive services, and to a wide variety of other services that they need and that they would be afforded under the essential health benefits of the Affordable Care Act. My bill would also result in a reduction in marketplace premiums thanks to the increased enrollment from a more balanced risk pool. So it would be a win-win all around. So at this time, Mr. President, as if in legislative session, I ask unanimous consent that the HELP Committee be discharged from further consideration of S 455 and the Senate proceed to its immediate consideration. I ask unanimous consent that the bill be considered read a third time and passed, and that the motion to reconsider be considered made and laid upon the table.
Is there objection?
Mr. President.
The senator from Indiana. Reserving the right to object, Obamacare has failed because it is a classic example of big government getting in cahoots with a healthcare industry that's broken. It was doomed to fail because when has big government and big business ever resulted in something that's going to cost less and be more effective? Under Obamacare, decisions are made by the healthcare industry executives and the federal government bureaucrats, not patients, not consumers. This program is authorizing millions of dollars we don't have to prop up a system that's not working. If Obamacare was working, it would sell itself. But it doesn't work, costs continue to rise, and Americans continue to be stuck with the bill. I believe there are things that Obamacare does that we should keep. Actually incorporated it into my own business's plan back before the law required you to do it. I covered pre-existing conditions and no cap on coverage. The pillars of Obamacare, we should all accept that. And when they added keeping kids on there until they're 26, that's fine too. Those ships have sailed. But the Affordable Care Act is not remotely affordable, and it's only going to get worse. I applaud the Trump administration for doing their due diligence on how healthcare policy changes are going to affect average Americans. And they're taking the approach to not go deeper in the hole with something like Obamacare, but to reform the industry by making it competitive, transparent, eliminate the barriers to entry, and yes, encourage the healthcare consumer to get involved in his or her own well-being. And I do believe President Trump is right. The Republicans can be the party of health care without involving more government. But we need to do that by putting more power back into the hands of the American people, not ceding total power to government bureaucrats and big healthcare executives. I've got a better idea. Truth in Pricing Act. My bill I'm countering with encapsulates some of the ideas behind the proposed and final rules announced by the White House last week, which I fully support. The complex, opaque nature of healthcare pricing makes it difficult for consumers to anticipate, measure, compare healthcare costs and coverage options. Hospitals have a charge master that nobody can understand, which actually inflates retail prices billable to a patient or an insurance provider, but insurers usually negotiate steep discounts to these inflated prices that consumers and the employers who pay all the bills never see any of that. It's done behind closed doors. More pricing transparency would address this market failure. Increase competition, give more decision-making to the people that are supposed to use it. This is why I introduced the Truth in Pricing Act, which requires health insurers to disclose negotiated rates, including any cost-sharing obligations for consumers for health care services covered under their health plans. It is difficult for insured consumers to shop for health care services in our current opaque and broken market within which Obamacare works, especially if they don't know actual prices. And insurers have the unique ability to provide this information to consumers. Why subsidize insurance companies to pay for navigators and insurance agents when we can instead make the market work better and be more consumer-driven and transparent? This is the way we break the stranglehold that government and big healthcare has on healthcare delivery. I ask unanimous consent that the senator modify her request and instead, as if in legislative session, the Committee on Health be discharged from further consideration of Senate Bill 913, the True Price Act, and the Senate proceed to its immediate consideration. I ask unanimous consent that the bill be considered, read a third time, and passed, and that the motion to reconsider be considered made and laid upon the table.
Does the senator so modify her request?
Reserving the right to object, Mr. President. Let me just say that I agree with my colleague that we need more transparency in healthcare pricing. I would argue that one of the places that we most need that transparency is when it comes to the price of prescription drugs. As I'm sure my colleague knows, the cost of prescription drugs are probably the biggest cost driver right now in increases in healthcare. And yet we in Congress and the Centers for Medicare and Medicaid are stymied because they can't negotiate with the big drug companies to lower the price of prescription drugs and to make that more transparent to consumers. You know, the Veterans Administration can negotiate for the cost of prescription drugs, and if you talk to any veterans about the cost of their prescription drugs and compare them to what people are paying in the marketplace, there is a huge difference because they have that ability to negotiate. So I'm sure that at some point we could probably find some agreement on transparency that would make sense. I think what my colleague is proposing is not something that's had a chance to go through the HELP committee, and so needs a further look. I would want to know what the hospitals in New Hampshire and the doctors in my state and consumers, my insurance department, would have to say about that. And until I find that out, I would have to object to what my colleague is proposing. But I would hope that we could work together to address the challenges that my constituents, and I'm sure your constituents, are facing because of the costs of health care. You know, you talked about the failure of the Affordable Care Act. Actually, in New Hampshire, we have over 90,000 people who have now gotten coverage for health insurance because of the Affordable Care Act. Through the expansion of Medicaid, we have reduced the number of uninsured in New Hampshire to half of the number that we had before we passed the Affordable Care Act. And what my legislation would do is to help people understand what the filing period is, how to sign up for the Affordable Care Act and health insurance, and in fact, under the Affordable Care Act as it exists now, according to estimates from the administration, approximately 54% of Granite Staters who are shopping for coverage on healthcare.gov are eligible for a plan with net monthly premiums of less than $75 after accounting for tax credits. And nearly 40% of Granite Staters shopping on healthcare.gov this year couldn't find a plan with net monthly premiums under $10. But now the cautionary note is that when constituents of mine or in Indiana or anywhere else in the country are shopping for plans, they need to watch out for those short-term, limited duration insurance plans, what are commonly called junk plans, because they are not required to cover pre-existing conditions. And I was pleased to hear my colleague from Indiana say that pre-existing condition coverage is important. Those junk plans are not required to provide coverage for essential health benefits like maternity care, prescription drugs, mental health services. And if you don't pay very careful attention when you go on the healthcare.gov website, you can be redirected to third-party insurance broker sites that sell both junk plans and ACA-compliant marketplace plans. That creates further confusion for customers, and what we've heard is that those insurance brokers are able to charge multiple times the price for those plans for their fee than they are for plans under the Affordable Care Act. The administration has been allowing these links to redirect consumers to sites that sell junk plans, even though the ACA expressly prohibits any health insurance exchange from making available any plans that are not qualified health plans under the Affordable Care Act. A number of my colleagues and I have been pressing the administration to conduct better oversight of brokers to ensure that healthcare.gov customers are not being sold junk plans. And I would urge consumers, when they go on the website, to make sure that you stay on the healthcare.gov website or your state's official health insurance exchange website when you're shopping for coverage. Be careful when you click on links that provide assistance from third-party insurance brokers. And I encourage Granite Staters and people across this country who need health insurance coverage, take a look at their options between now and December 15th during this year's open enrollment period. There is still time to enroll. It's important to tell your friends and neighbors and your family members who may not know about open enrollment, because the amount of money available for outreach has been reduced so dramatically. When the administration was trying to repeal the Affordable Care Act, and this Senate voted, Americans across the country made their voices heard. Now we need that same level of engagement to raise awareness of this year's open enrollment, to overcome this administration's sabotage of the ACA. Thank you, Mr. President, and if it was not clear earlier, I object.